Louisiana's stay-at-home order is running through the end of the month, but the new mandate here in New Orleans extends it to May the 16th. That is a month from today. We don't know if those orders will be extended again or if maybe we'll be able to reopen the economy a little sooner. Leslie has some more details on that.
Non-essential businesses have been closed for over a month now. We're not sure when it'll happen, but there's been talk about reopening the economy. So this morning, we're joined by James Spiro, Morgan Stanley financial advisor. Thank you so much for being with us today. And first of all,
good to be with you.
When we talk about reopening the economy, what does that look like?
Well, I think that's a work in progress. I think it's quite likely that it certainly won't be like flipping a light switch. Obviously, this disease is progressing across the country at different paces. So I think it's going to be a function, as a number of administration officials have said, it'll be a function of people who are on the ground, who can provide a local assessment as to how safe it is, the health of the population, how backed up the hospitals are. And I think it'll also be a function of advice from the broader medical community. But I think you would see it opened likely, Leslie, in stages, whereas certain businesses that might be a little bit more easy to open up, perhaps larger department stores where people are less inclined to be close to each other. Things like that might be more easy to open in restaurants, movie theaters, where people might be in close proximity. And with respect to the latter, I think you could see things implemented that might try to reduce the risk of spreading a disease if someone were ill. So there could be partitions, there could be seating in every other seat in a movie theater, in a plane, things like that. I think it's to be determined, but I think you'll see it done in stages.
And you just touched on it. We've heard when restaurants open back up, they'll be at 50% occupancy. You know, maybe skip a couple tables, have somebody over here, have somebody over here. Can businesses survive that way?
Well, you know, you raise a very interesting point. This has occurred to me. It's not uniformly true, but many businesses have meaningful fixed costs. And, you know, those have to be borne, light, heat, utilities, salaries, and so forth, insurance. And a lot of businesses operate on just, you know, that last 5 to 10% of business. That's the difference between being in profitable and being in an unprofitable situation. So as a matter of theory, it sounds good and okay, we'll be able to get through, we'll work at half speed for a while. I'm not sure. I think, you know, better capitalized businesses will be able to survive more than less well-capitalized businesses. But you raise a very good point, and it's crossed my mind, and I think it's a point of concern. And I know the government will try to help as much as it can, but the government doesn't have an infinite amount of money, no matter what people may say to the contrary.
Just from, I mean, your daily job, how many businesses do you think when we start to reopen aren't going to even be able to reopen? What percentage would you think locally?
I would just be winging it, but I will tell you that I walk down the street. I'm at work. I'm downtown. I walk down the street, and there's not a lot of population here. You look at the businesses that are still opening and struggling, largely restaurants, smaller restaurants, takeout, that kind of thing. The supermarkets are doing well, but you ask yourself, could some of these smaller businesses survive in this kind of environment for a long period of time? And I wouldn't think so. I simply don't know, but I don't think it's going to be 1 or 2% aren't going to make it. I think, regrettably, a lot of them will not be able to get through to the other side of this. I hope I'm wrong. I don't think I will be. And as I say, the government can throw a lot of money at it, but not ad nauseum.
And Spiro does think we'll have a nasty recession on the level of 2008, but he points out it's not all doom and gloom. 2008 was the financial crisis. This is a healthcare crisis that's manifested itself into a financial crisis. He said literally the entire world's working on a vaccine. He expects one within a year, and he said that could help turn things around rather quickly.